Hi, everyone. Thank you for joining us today. We'll go ahead and get started. Welcome to the last of TAP's Virtual Health Mental Health series. Our topic today is on building a mental health community as well as how to help a friend or family member. I'm Hannah and I'm with TAP ATL. I'm their Health and Wellness Chair, and I'll be introducing our speakers today. So moving to our agenda for today, um, we will start with introducing our panelists, followed by a presentation on how to recognize when somebody needs mental health support, how to help a friend and family member, what to do when it's beyond your ability to help, as well as how to practice self-care and stress management. Then we'll have a Q&A session with our panelists. During today's session, you can type your questions in the Q&A box at any time, and we will try to answer them during that section. I want to start with some introductory remarks. So May is Mental Health Awareness Month. This is important because while 1 in 5 people will experience a mental health illness, everybody faces challenges in life that can impact our mental health. And I also wanted to briefly touch base on how the census and mental health are related. As you may know, TAP has been promoting our Right in Taiwanese census campaign, and filling out the census matters because the government distributes funding and resources based on the population count. These include mental health resources. If we don't count it, our community doesn't get the resources that it deserves. I'll go ahead and now introduce our panelists for today. Jojo Lee is a national certified counselor and a BBS registered licensed professional clinical counselor. We also have Victoria Lin, who is a physical medicine and rehabilitation physician and a TAP San Diego Health Wellness Coacher. We also have Tiffany Chow, who is a California state licensed guidance counselor and a certified education therapist for students in grades pre-K to 12. Lastly, we have David Johnson, who is a licensed professional clinical counselor and a certified clinician mental health counselor in San Mateo, California. Now our panelists will begin their presentation.
Hi, everybody. I thank you for filling out the poll when you first came in. I'm going to show you the responses. So you can see that many of you know somebody who has had a mental health issue in the past year, or someone who is currently dealing with one. And clearly this is an issue that affects many people, so we're really glad you're here today. Overall, in the US, 1 in 5 adults experience a mental health issue of some kind each year. This is based on a national study done in 2018. And of those adults, 15% identify as Asian. So I know you're here. The presentation is about how to help a friend. And of course, your friend may or may not be Asian. But since this is a TAP event, we figured the stats were still relevant because you may or may not be Asian as well. So 6% of all Asian adults in the US received mental health services, which is actually the smallest racial group of all groups. And compared to white people, they tend to underreport mental health concerns and are 3 times less likely to seek treatment. At the same time, Asian adults are more likely to consider and attempt suicide. And so there are, reasons why these numbers don't fit the actual population data. It's possible that they're underreported, which Jojo will get into a little bit later. And one of the questions was about the stigma that mental health has in Asian populations, and so that's certainly a factor as well. So you can see that this topic certainly affects many people, whether it's yourself or someone you know. And just to start with, you being here to listen and to learn is a really great first step in helping your friend, but also just helping there be a greater understanding of mental health issues. So let's say you have a friend or a loved one who you think might need some support, but you're not really sure. We are not actually here to help you diagnose them because there are people whose actual jobs it is to do that. David and JoJo went to school for a long time and do this professionally. But we can try and help you figure out what to look out for, what might be a red flag. Chances are you are probably already noticing that something is different about your friend. So, pretty much changes in either direction for areas of their life, like appetite, if they're eating a lot more or less, if they're gaining or losing weight, if you notice that they're sleeping too much or not enough, if their activity level is changing significantly, like they're not that interested in doing things anymore, or suddenly they're really interested in trying all these new kinds of things. And of course, if their mood seems to be more or less positive than usual. So these can be signs that something might be going on with your friend. It's important to keep in mind that having changes in appetite, sleep, interest, mood are normal. And sometimes they're even adaptive. So it's good to be sad or stressed or eating more or less, depending on what's going on in your life. So, for example, right now during the pandemic, I am definitely sleeping more, eating more, and I'm a little bit more sad because things are what they are. And I definitely have a very different activity level than my regular life. Um, does that mean that I have a mental health issue or concern going on? So the key question to ask yourself if you're observing these changes in a friend or yourself even is, are these changes affecting my important parts of my life? So for example, am I still able to go to work if I have a job? Am I able to fulfill my responsibilities at work? Um, are my friendships being affected? Are if I'm dating somebody, is that relationship being impacted? And is my physical health suffering? So if the answer is yes, these changes are happening and I'm not able to go to work or I'm losing friends or I'm actually sick, then yeah, it's more likely that something is going on and that this friend needs support. So, to illustrate this a little bit more, you might have heard the theory out there that all the characters from Winnie the Pooh represent serious mental health problems. So, for example, Eeyore is depressed, and um, Tigger has ADHD, and Christopher Robin has hallucinations, so he might be schizophrenic. And so, let's say you take that question and ask it of these characters, are their lives actually problematic? Are they actually having issues? And the answer is no. They are living their best lives together in 100 Acre Wood. They love each other, they have fun, they have adventures. So those character traits are just part of their personality. Um, if, however, if you look at Christopher Robin and he is not able to learn in school, he can't learn to read and write because he's too busy imagining conversations with his friends. If he's not making friends, then you might say that, okay, Christopher Robin might have some mental health issues and we should get him some help. But otherwise, don't worry about the Winnie the Pooh folks. They're all doing great. So I'm going to pass off to JoJo for our next slide.
All right. Hi, everyone. Thank you, Tiffany. So I'm going to talk a little bit about the barrier to asking for help or offering help. Obviously, there's so many of them, and I'm just going to cover a very common based on my personal clinical experience and the research that I've done in the past. So I conclude with like 4 general bullet points here. The first one is kind of like more cultural and religious expectations. So especially for a lot of us here, good amount if you come from a background that really just does not believe in mental health system, like maybe your parents or sister or someone have told you in the past, don't share a concern to others. Why would you do that? Talk to your pastor, talk to your parents, talk to your neighbor who used to be a traditional healer, pray, go to the church, talk to your pastor. So like all these things might be the reason why that makes you feel like, you know what? I don't think I need help. Another thing that if you actually attend to our previous mental health series, model minority myth, it's also a very common thing among Asian American culture, where we are portrayed as being more self-sufficient. We can do all these things by ourselves. We don't need help. And when you actually ask for help, sometimes that means that you're too weak. And oftentimes in my job, I always have to kind of encourage my client, letting them know that, you know what, asking for help actually requires way more courage than just keep it to yourself. So that might be one of the barrier. Oftentimes I also hear people tell me that, like, I'm just not that crazy. Why do I need help? Just feeling kind of like ashamed or embarrassed. Go to seek a counselor or even just talk to someone else, because like maybe you are in a position that you're more in an administrative role, you're in a higher managerial role, or you are the parent. Then you feel like, I don't want to share it out because it's like I'm supposed to be the strong person in the family. So that might be one of the other reason. Another one that I oftentimes tell people is that when you are trying to offering help, remember, meet where they're at. Maybe they're just not ready to change at the time. I'm not sure if you ever experienced that when you try to offer help to someone and the other person is just keep saying no to you. Maybe it's time to just step back a little bit and ask them, like, hey, are you like, I see something is struggling here. Maybe you just kind of have to wheel back and understand that maybe that person is just not ready to change. Or on the other hand, I often tell people is that mental health wound, it's invisible. Something that you might not even noticing that you're struggling. Versus if you see someone is bleeding, you're not going to be like, oh, it's okay, just suck it up. Like, you're fine. 2 days later, you'll be fine. You're not going to tell someone like that. However, when people struggle with mental illness or just mental concern, you can't really tell. You might be able to tell that this person looks stressed, or emotionally you can tell like something is different from that person. However, if that person's not willing to share or not willing to open up, then you can't really like help that person. So just keep that in mind. The very last one is just don't know where and how to get help. I have a lot of clients come to me and tell me that, like, Jojo, you just don't know. I have to jump through all this hoop before I can actually come to see you. I have to talk to my insurance. I have to talk to my PCP to get a referral. There's so many different like credentials, psychologists, psychiatrists, therapists, counselor. There's so many of them. So it can be overwhelming to even just to start the first step. And in my next slide, I'm going to talk a little bit more about how does it look like and what we can do if we are friends or family and we want to help others. So I'm just going to show you a little bit. I love memes. I'm just a little personal preference. This is a little memes that I want to share with everyone. When therapists ask, like, how does that make you feel? Client respond, I'm not very good at describing my emotions. Maybe you could hold a bunch of memes picture until I see one that I could normally comment the word mood on. So that is actually very common, especially for people who come from a background that sharing, articulating emotion is not something that they learn throughout their childhood. So when you go to a therapist, you'd be like, how are you feeling? Good, I guess. So this is just a very little, in a humor way, to depict that what are some common barriers that sometimes we, as a person, when we go to see a therapist or other people who want to seek help, but it's this the barrier to stop them from actually seeking help. So we're going to move on to the next slide and talk about what are some things that we can do to help our friends. I think the best way to show how to help is to actually show you guys a video. This is actually one of my favorite videos when it comes to sharing how does it look like on both perspectives. It is a YouTube video. I'm gonna wait until to show it. Oh, and here's my dog also agreed to it.
There's all this pressure, you know? And sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's gonna stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever gonna stop.
Yeah. you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there...
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing...
You always do this. You always try to fix things when what I really need is for you to just listen.
No, see, I don't think that is what you need. I think what you need is to get the nail
See, you're
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just... Sometimes it's like there's this achy... I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
Yeah, that sounds really hard.
It is. Thank you. Ow!
Oh, come on. Ow. If you would just...
Don't...
Try to see things my way. Do I have to keep on talking till I can't go on? We can work it out. We can...
I hope I always laugh. I watched this video, I don't even know how many times already. Every time I watch, it's just like, yes. I hope this video just kind of like show you a very snapshot of like, how does it look like? I'm sure some of us here can relate to it. When someone comes to you and asks for help, you'd be like, hey, I think the answer is pretty obvious. But here's the thing. I want to explain a little bit about some do's and don'ts. The first thing that you see, the lady was like, you're not listening. Yes, and what she really wants is just the other person to listen. And that's where I meant by active listening versus troubleshooting. Before you actually providing solutions to someone, just listen. Maybe that's all they need. The second of all, it's inviting versus assuming. It means that actually give them some questions like, hey, I can tell that you're struggling a little bit and you're explaining to me you're having all this pain in your forehead. How can I make you feel better? Versus just assuming that this person just wants you to pull that nail out. As I mentioned in the earlier slide, is that maybe that person is not ready for that yet. So by you assuming that person is ready to receive help, that might actually push them back more. The last one is, actually not the last one, second to the last one is radical genuine versus losing personal boundary. I think this is very important for us to understand that I always tell people, never, ever, ever, ever work harder than the other person. If someone comes to you for help, making sure that you're not working harder than them, because by doing that, now it's actually gonna burn yourself out faster. So being radically genuine, it means that you just kind of like explain to them like, look, I've been receiving your calls or texts maybe like 2, 3 a.m. every morning, and most of the texts coming from when you're drunk. I don't know if that's helpful, but I'm starting to feel like this is not healthy, and I'm very concerned about you. Do you feel comfortable that we can do something differently? If so, I actually have some resources I would like to offer you. And what does it mean by losing personal boundary? It means that sometimes you try to help someone and the other person might ask you to do certain things that is actually against your personal value, might be against your personal just lifestyle. And at the time when that happened, which means to my next slide is, the next point is that it is really okay to say no. Like if that's not what you feel comfortable doing, it's okay to say no. And I also want to normalizing that it is okay to feel frustrated and rejected when the other person just keeps shooting all the ideas that you provide. Again, as I mentioned, I really like memes, so I'm going to show you another memes, just a little joke to demonstrate that. How does it look like when your brain is just constantly telling you therapy, therapy, and then your other side is like, well, maybe I just need to play more video game. You know, maybe I just need to like buy more stuff. Like, no, I don't need therapy, until like your brain literally screaming therapy. Hopefully one day when you feel ready, that's where you move on to the next step. And I'm going to pass it on to my colleague, David, to explain a little bit more about when is it beyond your ability to help.
Thank you, Jojo. That was really enjoyable. I liked that so much. So I just want to say I am profoundly honored to be joining you today. This is my first experience with TAP, and I'm really happy to be part of it. And now what we're going to talk about is how to manage a situation when it's beyond your ability to just be a friend, to just simply ask somebody, when it really is as serious as a nail sticking out of the head, that needs to be handled by a professional. So a little bit about what I do and why I'm talking about this, just to give some context and background. I work in an early psychosis clinic in San Mateo, California at Felton Institute. So I have specialty training in treating and diagnosing severe mental health disorders such as schizophrenia, bipolar disorder, situations where people have a genuine confusion about what is real and what is not. And so, as you can imagine, when people first experience the emerging of this disorder in their life, it can be quite disruptive, and oftentimes their family and their friends go through an experience where maybe there's a hospitalization, and they often don't know how to be supportive or healthy. Sometimes, less often, they might overreact and say, "You're hearing voices, then it's time to go to the hospital." But more often than not, they are noticing small signs and they simply don't know how to pick up on those cues or how to suggest somebody get some help. And unfortunately, what we often see is that if somebody is experiencing an actual emerging of a serious illness, time is of the essence. People can live healthy and productive lives. People can learn to manage their symptoms, even if it's something serious like a delusion or voices, if they get help early. So it is really crucial to find out what's going on. Even if it's something like an addiction, if there is an early intervention, you can mitigate the damage that a serious mental health issue can do to the overall trajectory of somebody's life, or to the relationships and the people around them, if you can get some help early. And that's why it's so important as a friend or a family member of somebody who's really potentially suffering to be able to ask some really key questions. And we're going to go through those right now. So how do you know what to ask? Well, here are a couple of guidelines. The first way to figure out what to ask is look for any active thoughts about death, serious injury, or an imminent trauma to your friend or family member or to anybody else. So you're looking for any active thoughts about death, serious injury, or imminent trauma. So you might ask it in this way. Have you thought about being dead or what it might like to be dead? Have you wished you were dead or wished you could go to sleep and never wake up? Do you wish your partner, boss, family member, ex weren't alive anymore? So by asking these questions, asking them without expecting a particular answer, you can allow your loved one, your family member to come forth and talk about what's actually bothering them. If they're answering you with anything other than no, so if they're answering yes or maybe, then how do you respond? You can respond by saying, "I'm really concerned about you." And you can then ask them to seek professional help and also seek professional help for them. That's pretty key. We'll talk later in the presentation about how to get them connected to some resources, but it's imperative that you hear or that they hear that you're concerned for them. So that's question number one is, are we dealing with an emergency situation here? Question number two, you can ask, are we talking about anything that could cause significant distress leading to the person's foreseeable need for hospitalization? So this may not necessarily be like calling 911 today, but if we don't leave things the way if there's no change, could this end up in a hospital situation? So another way of going about this might be, you can ask, how have these problems affected your relationships? Or how have these problems affected the way you interact with other people? You can ask your friend or loved one, how have these problems affected your ability to go to work or go to school? How have they gotten in the way of your ability to do everyday things at home, like getting dressed, bathing, brushing your teeth, or other things that are important to you? So what you're looking for when you ask a question like this is if you're looking for significant interruption in two areas, such as relationships, work, school, self-care. If it's more than one area, if it's two or more, then the follow-up that you'd want to do at that point is say, I'm very concerned about you. I think it's time to seek some professional help here. And then you can ask them if it's all right if you follow up with them in a few days to see if they've sought professional help. So number one, ask about imminent death or serious injury. Number two, ask about foreseeable hospitalization. And I hope it's not too difficult to imagine yourself actually using some of those words. I know these are really difficult questions to ask, but think about how difficult it might be if you have the opportunity to ask and then you don't. So a couple of do's and don'ts. On the next slide, we're gonna ask a little bit about what should you keep in mind, what should you not do in handling delicate questions like this. First thing to keep in mind is please do not agree to keep a mental health issue like this, something that's serious, a secret. So avoid telling somebody, sure, just keep it between you and me. Avoid agreeing to do that. Avoid allowing them to become isolated, because if there's one thing that is pretty surely going to lead to more problems or problems getting worse, it's somebody spending a lot of time by themselves when they're already not doing well. Do be prepared to monitor yourself for what we call vicarious trauma or any vicarious mental health problems, meaning that sometimes hearing about what somebody's struggling with can actually affect you. It can be very distressing to learn that your loved one is having thoughts of suicide. That can make anybody feel suddenly very anxious. So caring for others feels good, but it's also really tough work. Make sure you take care of yourself. And finally, do be sure to refer to our list of resources that is going to accompany this presentation, and we'll talk more about. If you have any questions about anything that I've shared, please shoot me some questions and I'll be happy to address any specific things or specific resources at the question and answer portion. So now we are going to turn it over to asking how to help yourself and how to take care of yourself. So with that, we are going to have our next person come in. I believe that is Victoria.
Yep. All right. Thanks, David. I wanted to talk to you all about taking care of yourself, because that's how you'll be able to help someone else effectively. Because if you become unwell yourself, if you're not able to even take care of your basic needs or your own emotions, then you won't be able to help others. So to take care of yourself, you have to master the basics first. Feed yourself nutritious food, stay hydrated, and get plenty of sleep. We all already know this, but when we get stressed out, we sometimes forget these things. We need to eat protein and vegetables to give our body the building blocks for good health. We need to stay hydrated by drinking water, which helps us inside and out by flushing out body waste and keeping our skin healthy. And we need regular sleep, a regular sleep schedule, getting at least 7 hours of sleep at night in order for our brain and body to get the necessary repairs to function well. A big part of self-care is also stress management. And although stress is a part of daily life and can help you do great things, too much constant stress over a long period of time can cause many problems on your body, including weakening your immune system. Now, the goal of stress management isn't to get rid of stress completely. It's to give you a break from feeling stressed out so that you can stay healthy, keep good relationships with other people, and give you a feeling of more control in your life. When someone that you care about is going through a tough time, it's stressful just hearing about it. Even after you finish interacting with that person and giving your support, you could be feeling a lot of stress that affects the rest of your day. So what can you do to cope when you're feeling overwhelmed? One simple trick I like is to do a deep breathing exercise. This is also called belly breathing or diaphragmatic breathing, because it involves breathing deeply into your belly by activating the diaphragm, which is the main muscle you use to breathe. I'd like to go over this exercise with you right now. It's really quick. And I'm going to talk through how the exercise is done first, and then I'll go over it again with less talking. So start with sitting comfortably in a chair, or you can lie down if you'd like, and check in with how you feel right now. On a scale from 1 to 10, how stressed are you feeling? Now, if you have no clue, just pick 5 as a reference for later, because we'll do this again at the end of the exercise. And try not to judge yourself about the number, just make a note of it. Now, rest your hands on your stomach, and if you'd like, close your eyes. Start by breathing in through your nose as you slowly count to 4, and feel your stomach fill up with air as you breathe in. Try and take in as much air as you can. Then breathe out slowly through your nose as you count to 8. Feel your stomach slowly fall. Release your tension as you breathe out. Notice that you're exhaling twice as long as your inhale. What this does is it slows down your breathing and allows your mind to focus on this one task, which helps to calm you down. Make sure that when you inhale, you take a deep enough breath in those 4 counts that you're able to exhale for the full 8 counts. It takes practice, so if you run out of air before counting to 8 the first few times, don't worry about it. Just try your best, and with more practice, you'll get there. Now let's do the exercise again, and I'll talk less this time. Rest your hands on your stomach, close your eyes, breathe in through your nose, 1, 2, 3, 4. Breathe out, 1, 2, 3, 4, 5, 6, 7, 8. Do another round on your own. To get the full benefit of deep breathing, you can repeat this 5 times. Afterwards, check in with yourself. On a scale from 1 to 10, how stressed are you feeling compared to before the exercise? Now, there's no right or wrong answer to this. It's just to get you more aware of how you're feeling in the moment. There are many different variations of deep breathing exercises. You can hold your breath for a few counts before exhaling, or you can exhale through your mouth with pursed lips. We'll send out a resource guide that you can look at with links for you to explore different breathing techniques and find out which works best for you. I like this exercise I just taught you because it's the easiest to start out with. Just breathing in and out through your nose, exhaling twice as long as your inhale. Another great stress reliever is an exercise called progressive muscle relaxation, where you tense a group of muscles when you breathe in and relax them when you breathe out. You do this sequentially with different muscle groups in your body from your toes to your forehead. And we won't have time to go over this exercise today, but if you're interested, you can look for the links in our resource list. Aside from these relaxation exercises, there are so many other ways to take care of yourself in your daily life. Move around, stretch, or take a walk. Do something you like, listen to music, draw, or paint a picture. Revisit your old hobbies. You can write in the journal to keep track of your thoughts. And getting organized can also reduce stress. That means cleaning up the mess around your home and also prioritizing the more important things you need to get done. Lastly, show kindness and consideration to yourself and others. This makes your world a more pleasant place to live in. Allow yourself to ask for help too. If you're finding that your work, personal life, and sleep are suffering despite your best efforts, you could benefit from seeking professional help yourself. Now, that concludes our formal presentation, and we'd like to open the Q&A discussion with everyone.
So I'm going to start with some of the questions that people submitted ahead of time, and you can use the Q&A button to type in more if you have any that are popping up for you right now. So can we start with Victoria? How would you help a friend who on multiple occasions vented their anxieties and problems, and yet when you try to encourage them to seek mental health options, they're very hesitant? I don't mind listening to a friend about their problems, but sometimes it can be emotionally draining when all you hear about is their problems.
Well, that is tough, you know, because you obviously care about that person and you want to help them, but at the same time, they're kind of impacting your own life. I think it's important to set boundaries, as Jojo had mentioned earlier. Maybe she can elaborate more on different tips. But perhaps setting kind of a boundary of maybe can we set aside a time once a week for us to chat, because then that way you can kind of take care of yourself, mentally prepare yourself for that conversation and be in a better place, rather than having that person kind of coming at you whenever, and it's kind of unexpected and gets you off guard. I don't know if Jojo or David have anything else to add.
Along the same line, thank you, Victoria. It's very similar, as I mentioned before, about just being radically genuine versus kind of like doing things that make you feel uncomfortable. I'm also speaking from a therapist perspective, obviously. Sometimes it's very important that we kind of have to let the other person know how we truly feel. Just express to them like, hey, I'm noticing that you're complaining a lot, especially lately. I wonder, is there anything that we can help you? We can like brainstorm some other idea, like so that it balance it out. Like, I want to listen to you, but I gotta be honest with you. Sometimes hearing a lot of negativity also drains myself out. So what about I know right now it's a little bit different because we can't really go out, but let's say like, hey, let's do a Netflix party together. Let's watch a movie. Let's do something more like positive activity. What do you like to do for fun? Let's do it together. Let's be creative, so that the person not only just associate with you as a person to complain, maybe you can also start initiating activity to create some positive memory for them. I don't know, David, you have something?
I think I do have something I might be able to add too. If you're having a sense that you are the only person in this individual's life that they can lean on, you might start to ask, like, you know, maybe they've complained to you and you've given your answer and they're still complaining. You might ask, you know, how was this for you? I noticed that, you know, this isn't the first time we've talked about this. Is this helpful? And asking if this is helpful and if they're getting something out of this might be a dialogue that will open up, well, maybe they need more support. You know, so, you know, it's a good technique that we use as therapists, but I would encourage people to do it with, you know, the people that they're close with too, saying like, is this what you needed? So back to the video where we saw with the, you know, it's not about the nail. It's asking the question, did I give you what you were, you know, and you may find that maybe you have to repeat the process because you've given something that you thought was helpful, and in turn, maybe they were actually looking for something completely different.
Thank you. So here's sort of a follow-up to this question, which is, what do you do, or how do you tell someone nicely if you can't or don't want to be the person they talk to about their problems? David, can you start?
Sure, thank you for that. So how do you tell them nicely if you don't want to be the one? I think starting with thank you might always be a good place to begin. That's safe. You know, thank you for sharing this with me. I'm honored that you feel close enough to me that you could share that. And, you know, I don't feel like I am going to be enough for this. Something like, if you're feeling like this person is going to need more than what you can give, you know, so thank you plus, and I don't know that I can give you the help that you really need. So I don't know if there's another panelist that wants to add to that.
I think maybe it's important to acknowledge that's a really tough thing to say. So you might need support on breaking up with a friend over not becoming their therapist. But
really good point, acknowledging how tough that is to share. Yeah.
So Jojo, I have now an opposite question for you, which is, for those of us who don't have experience talking about mental health issues, what are some basic initial ways to reach out to someone? In other words, what's an easy way to break the ice and open up the conversation?
Great question. I think obviously I'm telling you as I'm thinking, so be with me. I think there are a couple ways. First of all, when you don't know a lot about it, it's okay to actually let the other person know, like, hey, like I'm trying to help you out here, and I also have very limited knowledge. One thing that I want to also remind everyone that we do have a list of resources that we will offer to everyone here. We probably going to email to you all later. So that might be one way to look at it. Another thing to consider is let's kind of go back to what I mentioned earlier, inviting, like, again, ask the other person, like, hey, what do you think is going to be helpful right now? Do you think that we can just look together, like, hey, maybe there's so many nowadays there's so many different ways that we can do therapy, especially because of COVID. Basically a lot of the clinics are opening up to telehealth, so hey, what are some options that we have here? Maybe what you need is just we can explore some support groups together. And I also want to emphasize that it's okay to say that you don't know. And I also encourage you to personally go seek those help yourself. Actually, maybe look up those websites. What do they have to offer? Because sometimes, just as if you want to advocate for HIV and AIDS, you're probably going to volunteer, like look it up, do a little bit more research before you offer some sort of suggestions. Along the same line, maybe that's what we need here, is that you personally do some research and see what you have. It's okay to be a little more personal, like, hey, you know what, I noticed that my friend, once they seek therapy for 6 months, I actually saw improvement from them. I don't know if that's something that you're interested in, but this is my personal experience coming from how I interact with my friends. So these are my suggestions, unless I don't know if anyone else have anything to add on to it.
Well, the audience is asking really good questions that all kind of fit together. So thank you for that. Jojo just mentioned that we will send out a list of resources after the presentation. And one of the questions was, I'm interested to know more about mental health. Any books or readings that you could recommend for a starter? Our resource list will be a starter for you, but panelists, do you have any specific books? I would say maybe avoid Yahoo Answers, but anything from panelists?
I have a suggestion. So I put this on the resource list too. There's a social network called The Mighty, which is a place where people can go and be somewhat anonymous if they choose to. It's a place where people can have honest conversations about mental health, also physical health, and disability. There are people from The Mighty that do videos, so I think it's a really good place to talk about things when you can't find somebody that you feel comfortable talking about a mental health issue with. It's also a good place to look for resources on various specific mental health symptoms and issues.
I actually have a book, and actually this book is coming from David, who recommended me, called Maybe You Should Talk to Someone. It's a book. If you Google it, Maybe You Should Talk to Someone. It's on Amazon, and I think something that for yourself or for someone else, I think this is a great book to read. I would say, especially nowadays, there's so many different resources that you can do. You can either go on a website, listen to a podcast, check out YouTube videos. So I don't think I want to be the person to tell you, like, no, you should first start with Mental Health 101, this book. There's so many different resources, and check out all those resources that we offer. And this might be a way for you to help yourself and as other. If you're the person to help, wanting to help, I would just keep that in mind. Again, never, ever, ever work hard on the other person. So stay firm boundary when you want to offer help, inviting them versus telling them, like, hey, I've read this book and now you should do this.
Great, thank you both. So a couple sort of logistical questions. Maybe So where can I find a therapist who accepts my insurance? Victoria, do you want to take this one since you're a doctor? I don't know if you're familiar with the...
I'm not really familiar with mental health resources since I'm more in the physical medicine and rehab space.
Right, sorry about that. My brain went blank. I can answer also, or I can start, and then Jojo and David, you can chime in, which is oftentimes your health insurance will have a searchable directory of some kind. And so you can search by your plan or your provider and see which therapist in your location accept your insurance. Right now is actually possibly a really good time to start with a therapist because everything is happening over the phone or video. And so if a therapist normally is too far from where you live or where you work, right now that's not too much of a problem. And your health insurance, also you can call them to speak to someone to they can search for you. So those are two ways to find that. David or Jojo, any additional?
It's such a huge umbrella. So starting from the fact that you have insurance, good for you. That's lucky. And then it's going to be so individualized based on what you actually need, how frequently you might want to have therapy. And also like where you live, so from a starting point, I think I would say if you have insurance, terrific. Try and use your insurance network, and so search within your insurance. So whether it's Blue Cross or United Behavioral or Kaiser or whatever you have, search within your provider network first. Oftentimes, all you can really go by is the zip code and somebody's name. It might take a while to figure out what exactly do you want in a therapist. Sometimes you can separate out, do you want male or female, or do you want somebody who's maybe gender non-conforming? That would be terrific. So just in the same way that you'd look for somebody to do your hair or work on your car, this might be where it's good to get a recommendation from somebody that you know who's happy with what they have. Again, when we're dealing with therapy, a lot of people are understandably a little tight-lipped about who they work with because they want to keep things private. So it's a big wide field out there. It's a whole other question if you don't have insurance, or if you're willing to pay cash, you can afford to pay cash, and you don't necessarily have to go insurance. That's a whole other question. But if you have insurance, I'd say try and use your insurance network. And two other sources, if you're trying to narrow down your search, I would say use Psychology Today's Therapy Finder to narrow something down. And if you are not sure, and maybe you're going to just dip your toe into therapy for a little bit, Talkspace rather has online therapy that's fairly inexpensive. I can't say I've ever used it. I have talked to people who found it mildly helpful. So not a ringing endorsement.
Okay, thank you. Continuing on with the what about therapist questions, how do you encourage people to keep trying to seek help when they've already experienced bad initial therapist consultations? What should people expect from a good or fitting therapist? Maybe Jojo, you can take this one.
Totally, I would love to. This is actually kind of like right up my alley. I love telling people what to say when it comes to seeing therapists. In fact, my initial spiel is always about, look, we don't know each other. And kind of like our first couple of sessions, it's almost like speed dating in a way, like left, right, swap, but you also want to give each other a little bit more time. So I would suggest that especially for those who already have bad experience with your initial therapy or with a particular therapist, then I would ask myself, or encourage you to ask yourself that, like, first, what kind of model that you like? Like, do you like therapists that be more directive? Do you like therapists being a little more gentle? And as along the same line as what David mentioned, maybe it's the gender. Maybe you prefer a male therapist versus a female therapist. Maybe you prefer this particular area. Do a little bit more research. And when you're gonna go meet with another new therapist, explain to them, like, hey, I've done therapy before and it wasn't as great as I expect. So I'm noticing these are the things that I don't really appreciate, and these are the things that I enjoy. I would also do a little bit more research when it comes to the therapeutic model of the person. So there's so many different, I call T. Look, they're cognitive, like CBT, cognitive behavioral therapy, dialectical behavior therapy, all this different therapy that it's like up in the air. Because there's so many of them, I would say do a little bit research before you're gonna go see a therapist. Look into it. Like nowadays, the biggest term that we always use is evidence-based therapy. It means that it's supported by numerous research. It's supported by insurance. Insurance actually like the term, is a buzz term now, evidence-based treatment. So keep that in mind. It's okay that, let's say, the first session, it didn't really go too well. I would encourage you to tell your therapist the second time, like, hey, these are something that I noticed. I wonder, can we like explore that a little bit more? After all, I want everyone to understand that you're the one that pay for it. So find someone that you feel the most comfortable to talk to, because oftentimes therapy, the model itself is important, but it's also about the rapport between you and your therapist. So it's okay that if you find this person just not vibing, it's fine. Let the person know, like, hey, I tried it out and I don't think we are a good fit here. Do you have any referral? And oftentimes therapists, is actually part of their job is that they will refer you to someone else or give you some name and you can reach out to them. That's all I have.
Great, thank you, Jojo. So shifting gears a little bit, since this is a TAP event, so we have a couple questions about mental health as a concept for Asians and Asian Americans. So I'm going to try and combine some of the questions. How do you talk to other Asians, for example, immigrant parents, about mental health when there might be a cultural barrier or stigma towards approaching the topic? And then related to that, what can we do as an Asian American community to reduce this stigma that exists?
I think I can speak a little bit about it. I think it's important, especially talking to parents, understanding that there is already this expectations of like, maybe sometimes there's like, I know better than you. There might be that barrier to start off with. I would also try to change your terminology. Instead of saying like mental illness, change it to mental wellness. Hey, I wonder, like, do you start experiencing a lot of like headache, like chest, like pressure? Like oftentimes, especially with Asian American, instead of verbalizing their emotion, they kind of like geared more toward physical symptoms. Start from there, explaining to them that maybe all the symptoms that you're experiencing, it might be coming from external stress. So that might be an angle to go to. Another one, as a lot of us here, David, Victoria, and Tiffany, you mentioned as well, it's more about inviting the person instead of like, hey, I think like something wrong with you. Like, let's go see a doctor. More like coming from a concerning perspective, like, hey mom, like I noticing that you eat less and you used to go to all these like Zumba class, and I haven't seen you go to these classes for like the past 2 months, and what's going on here? Can I help you? Also try to use the word what happened versus what's wrong. Inviting them, like, is there any other physical symptom that is going on that maybe we can brainstorm it together? So you want to invite them that you both are on the same level versus you're like up here and like whoever that you want to help them is like down here. Another thing, advocating for mental health in Asian culture, we're going to start from I personally think, let's start from ourselves. Like maybe we can be that person to advocate, like to explain to other people. Maybe you personally have been seeking treatment in the past. Just go to see a support group, go see a counselor. You can be the person of explaining like, hey, I've done it in the past and it's been very helpful. Or go volunteer to a lot of different organizations, the NAMI, National Alliance of Mental Illness, the American Psychological Association, that one is specifically for Asian American. So there are many different organizations. I would say, let's start from there. If we want to advocate something, we want to know what are we advocating for. I use an example of like, if someone asks you, hey, have you ever heard of Ding Tai Fung? And I'd be like, yeah, it's good. And then they will ask you, have you tried before? No, I just heard about the name. So when you want to recommend something, you probably want to like at least get a little bit more familiar with it. Like maybe try it out yourself. Maybe you heard from your friends. Maybe you Yelped it. So these are some of my recommendations. I don't know if anyone else want to add on it.
I think I would add to the question of how do we help the Asian American community feel less stigma. Adding to what Jojo said, a lot of it just starts with person-to-person communication about mental health issues and just opening up the conversation in a natural way. You could drop into conversation that you went to this awesome mental health panel this weekend about Asian Americans and Taiwanese American professionals, and just not just making it be a normal thing that you learned about, and not really trying to push an agenda, but just weaving it into regular conversation and regular everyday life. So
actions speak louder than words a lot of times. So especially for people who know you very well, like your parents, your family, close friends, if you yourself go through a transformation by seeking professional mental health help, they will notice that. And that may be more influential on them as to accepting professional help.
Yeah, absolutely. Just showing yourself that you're part of it is important.
Yeah.
So, all right, it is close to noon, so we're going to wrap up the Q&A now. I know there were a handful of questions we didn't get to, and we're so grateful that all of you are so engaged and curious about these things. Our contact info is in here, and it will also be in the resource list. So if you have specific questions or there's something that jumps out at you that you wanted to follow up on, please feel free to reach out to us after the presentation. So Hannah, I'm gonna hand things over to you.
Awesome, thank you. So as Tiffany mentioned, here's the contact info. Moving on to the next slide, just before we conclude, I wanted to remind and encourage everybody to fill out the census regardless of whether you're Taiwanese or not. And just remember that the census will not ask you for sensitive information like your social security number, as well as any financial or bank information. So just be careful of that, because there's definitely been a lot of spam and things happening during this outbreak. And then lastly, thank you again for everybody for coming to today's session. We really had a great discussion with everybody. And so feel free to follow us on our Facebook channels or Instagram to keep in the loop of what's happening next. So thank you again for all your time.
Thank you, everyone.
Thank you.
Thanks.
Thanks a lot. Take care, everybody.